Welcome, everyone, to the Collateral Global podcast, where we explore the legacy of the COVID-19 pandemic on science, society, and public health policy. I'm delighted to have my guest with me today, Sosso Feindouno, who's a researcher from the French think tank FERDI, which is the Fondation pour les Études et Recherche sur le Development Internationale, which is an international development think tank based out of Paris, I think it is. No, in southern France. So along with a number of colleagues, Sosso published a paper in Social Science and Medicine earlier this year with the title COVID-19's Death Transfer to Sub-Saharan Africa, where him and his colleagues modeled the consequences of global lockdown and the recession that the global lockdown around the world precipitated on excess mortality in Sub-Saharan Africa. So it's a pleasure to have you on the podcast, Sosso.
Thank you. The pleasure is mine. Thank you for having me on this podcast. Thank you very much for inviting me.
Yeah, wonderful. So let's just jump right in here. I'm wondering what motivated you and your team to do this particular study.
Yeah, thank you very much, Kevin. I think I'm very pleased to talk about this paper, the paper entitled COVID-19 Death Transfer to Sub-Saharan Africa. Which just need to precise that this paper has been co-authored with two professors, Professor Jean-Louis Akan and Professor Patrick Guillemot. So to answer your questions, as you know, the COVID-19 pandemic has left the world in the state of uncertainty, and in the early stages of the pandemic, we observed that a huge body of research focused on official pandemic figures and apocalyptic projections for Africa. So there were many reasons for that. You know, there is the weakness of the continental health system, the inadequacy of health care funding. You have the lack of human resources. You have also the challenges posed by existing endemic disease in the continent. So all of which means that for many scientists and observers, the pandemic was expected to cause a devastating death tolls in Africa. But in the end, pandemic figures were relatively low in the continent. For example, just to mention, as for 20 February 2022, yes, despite a few deadly waves, Africa accounted for less than 3% of confirmed cases and nearly 4% of death in the world. So several factors may explain this, all of which are well documented in the literature. These include, example, the youth of African populations. I think many papers talk about that. You also have the inadequate testing and misdiagnosis, the climatic factors. You also have the epidemic experience and also the preventive measures, because the African continent has the chance to don't experience this very fastly. We have this in China and global north before coming in Africa. So the African authorities have the chance and the possibility to prepare this pandemic. So these are some reasons that can contribute. Nonetheless, there is a strong evidence that the official figures recorded concern direct mortality, and are probably underestimated and do not reflect the epidemic full penetrations, if you want, of Africa. So seeing that, most of people at that moment were talking about this direct effect. We found that there is something that is missing in that part. So our paper studies the indirect effect of the COVID-19 pandemic in Sub-Saharan Africa, showing how, in particular, that's the part, how the decisions to adopt a a lockdown policy in China and in the global north resulted in the transfer of mortality in sub-Saharan African countries, and as if you read the paper, you can see that it's based on the mechanism that operates in three phases. The first one is the recessions in the north, global north, which is the functions of the number of deaths avoided. Because there was a choice to be done at that moment by global north authorities between saving life and recession. They chose at that moment to save life, human life, and adopt the lockdown policies. And the second part of this mechanism was the recessions in the South African countries, sub-Saharan African countries, which is the functions of the recessions in the north. We try to analyze this in using two elements. We compare, we use the regressions analysis, trying to assess this via the trade channel. And the other point was to use other possibility just to try to compare the pre-pandemic income and the real income that we have observed from the IMF countries, and the two methodology result in the same outcome. To make to highlight these connections between the north and the south. And the third point that is more interesting in that is the high sensitivity of health indicators in Africa, mortality in South to deep recessions, and our results are in line with what we can see in the literature, that recessions episodes have a big impact, negative impact on death, health indicator in general and death indicator in particular, in vulnerable and fragile countries. That is not the case in the global north. In the global north, we can find that sometimes, recessions can contribute to ameliorate, to improve the health in the country. So at the end, for each of these three steps, the three parameters were estimated. We make a combination between the three parameters, making possible to determine the indirect mortality induced by recessions in Sub-Saharan Africa. Amounting that 600,000 deaths. This corresponds in particular to 6 to 7% increase in the crude death. And in mortality, 5 to 6 increase in under 5 mortality. So just to finish, these figures are still much higher than the number of deaths directly attributable to COVID-19 per se in the sub-Saharan African country population. So that was a big motivation, and the results that we got from our studies. Thank you.
Right. No, that's a great overview. And there's been quite a lot of controversy about the COVID mortality statistics in Africa, right? There was the WHO African head wrote a paper, I think, criticizing some of the larger models published in the Lancet, saying, no, these studies are exaggerating COVID mortality statistics in Africa. And to my knowledge, this is the first study that's estimated excess mortality from the lockdown-driven recession in Africa. Is that correct?
Yes, I can say yes or no, because let me precise something about this excess mortality point. I think excess mortality, as you highlighted, is a key indicator for measuring the impact of the pandemic. But the problem is the global debate on excess mortality has highlighted significant differences, in the way the pandemic has affected the global north and Africa. And African scientists and public health professionals argue that the indirect effect of the pandemic due to the economic and health disruptions, have led to a significant excess mortality in Africa. So that is why you can see the recent paper that we have, most of them are calling for a comprehensive approach, including better data collections, context specification solutions, and international support to address these challenges. Right. But, most studies that we have concerning excess mortality in Africa failed, I think you remarked that, failed to take into account all the parameters of the pandemics. These most of studies example tend to be biased. Because they are based their model adapted from rich countries, the noted one, where conditions and reality, because we know that the conditions and reality between the two universes are very different, they are not the same. So calculating excess mortality is proving very difficult in Africa, even if in most of African countries, due to the absence of, civil registration systems and statistics. That was a big problem. That is why for most of studies in Africa, it's difficult to calculate this excess mortality directly because data are missing.
Right, exactly. And your study, just to make it clear, it's an economic modeling study where you're taking very well, like this is a large field of research, has studied the consequences of recession in the global south, right? So, I mean, this is something that a lot of people were also very concerned about at the very beginning of the pandemic, knowing that, okay, a global economic recession driven by lockdown is going to have huge impacts on developing economies. And I mean the stats and the data from UN organizations on, let's say, food insecurity, 350 million people driven into food insecurity, poverty rates, 150 million people thrown into dire poverty, up to 300 plus million people falling below poverty lines. Educational impacts. I mean, this is a massive, government spending, also debt. Like, so most African countries have reduced their spending on social programs, even on health programs as well, because of the economic consequences. So we know that this has large, severe consequences on health in general. Your study on 600,000, that estimate, first of all, that's only for 2020, if I'm correct, right? So it's not looking at longer term impacts. The other thing to note is, and you cite this paper actually in your work, there is that a study based on healthcare system data for kids under 5, right? And I think it estimated like 100 or 150,000 extra under 5 deaths. And so that kind of fits broadly, I think, with the estimate that you have in the paper as well. So I'm just trying to find other sources of data that corroborate your estimate. So you've published this paper. What kind of conversations have you had? How have people been receptive to this? And what's the general feeling in the academic community when you present this?
Yeah, that is a good question, because the paper is very recent, and we know that with my co-author that the paper is a little bit provocative, so we cannot assess at that moment the reaction, but we have a good reaction, some good reactions about from these papers, but we hope that we can learn more from academics and other maybe politicians about this paper and the conclusions that we got from our analysis here.
Would you say that in Africa, I mean, obviously the pandemic experience in, let's say, America, Canada, or the UK, Western Europe, right, has been quite different than in Africa, right? So if we were to talk to public health professionals in Africa, would they share this perspective that lockdowns cause more harm than good in their communities? What do you think?
Yeah, I mean, that is a good point, because the perspective is different. in the early stages of the pandemic, academics in the north focus on the direct health effect of the COVID-19, and the need for appropriate lockdown measure to control the spread of the virus. And the main objective was to prevent health system from being submerged, and to save lives in the short term. This emphasis was also led in the global solidarity and the need to support low-income and vulnerable countries. So, at the beginning of COVID-19, most of papers was trying just to focus on that, on the lockdown and its effect in the North economics. And as the pandemic progressed, academics began to recognize and study the indirect impact of lockdown, particularly the severe economic consequences in regions such as Sub-Saharan Africa. So most of research at that moment began to highlight how global recessions, example, triggered by lockdown in the northern countries, exacerbated poverty and led to a significant increase in mortality from causes non-attributable to COVID-19. So academics in the north are increasingly just awards of the consequences of supporting lockdown measures, particularly
I would say that some of them are, a lot of them are not. And I think that Africa in general has a very important message to tell Northern academics about the consequences of shutting down society and treating humans like biohazards and the long-term consequences of that. Just kind of last question here. Do you think if there was another respiratory pandemic roughly similar to COVID, maybe a little bit more, higher mortality rate slightly, but kind of similar in a year, do you think that lockdown would be something that African countries would follow and implement?
Yes, because for that, let me mention that lockdown in the North economies and in Africa is not exactly the same, because you need for African country, example, to take into account the informality of the economy. So that is very important. So that is why, if we look at our paper example, for the so-called mechanism, one can make a critics to our paper to say that you are saying that all the lockdown policy in the North are conducted to the transfer of mortality on the South, in particular in Africa. What is the weight and what is the contributions of the lockdown South African countries' own lockdown? What is the contributions of this? And you have people like you can cite the work of Gottlieb, example, and colleague have a good work on that and show that the lockdown doesn't have a significant impact, in the recessions in Africa. And so the only contribution that we can get from this analysis is the lockdown policy that come from the North. The North. Yeah.
I mean, I think there's a lot of data, though, showing that lockdowns in, let's say, Uganda, South Africa, Senegal, I mean, the DRC did have huge impacts on even the informal sector, because it was shutting down, trade routes. There was a lot of, a rise in even, like, let's say, police corruption. I mean, there were a lot of ramifications for that. But I understand your paper is looking particularly at and modeling the consequences of a recession, right? And so it is an imperfect estimate. I would make the argument there's probably a lot more excess mortality attributed to COVID policies in Africa than 600,000 people. But I think it's an important contribution to the health economics literature, and something that needs a lot more work by African scholars. But just getting back to this question about lockdown as a policy decision, sort of feeling the pulse of how African leaders and the policy class, how they remember and think about COVID. Do you think that they will, go along with national lockdowns in the future, or do you think there's a reluctance there, or do you think they'll kind of follow the cues of, let's say, WHO recommendations or what happens in England or whatnot?
Yeah, I think a growing number of studies, because I'm trying to be in line with the literature, a growing number of studies have critically examined the global response to COVID-19, including the impact of the lockdown in the north. So these studies often mentions the outsized effect on developing countries, including reduced income, increasing, example, you cite this case, the food insecurity and higher mortality rates due to the economic hardship, and it's widely acknowledged that the decision to implement lockdown measure has involved significant trade-off. All agree that while these measures have been crucial or critical to managing the debt crisis in the short term, they have also contributed to severe economic downtown that have led to last effect on vulnerable regions, including Africa. So, just to conclude on that, this debate call for a rethinking. I'm talking about political science. For a rethinking of global health strategy to ensure more equitable outcome in future pandemics. And this includes advocating international supports in terms of financial aid, the capacity building and technology transfer to improve resilience to future crises in Africa. So as the future and health of the continent populations hugely depend on it. Yeah.
Okay. Well, thanks so much for joining us, Sosso, today. Appreciate it.
Thank you so much for inviting me. Thank you.